Doctor, so many people are on prescription drugs. So many are on multiple prescription drugs. What do they need to know about what potentially those drugs are doing in terms of nutrients to their body and possibly depleting and causing other problems?
I'm doing a lecture in November of 2013 in Las Vegas at a convention called the AMMG Conference, the Age Management Medicine Group Conference. I'm the chairman of that organization. We'll have 600 doctors there at our meeting. And I'm doing a lecture on the implications of polypharmacy on the aging process. So all of these drugs that you're taking, what are the implications on how you're going to age and how you may accelerate your aging process? It is an area that, with my patients, people that come to see me are on 6, 7, 8, 10 drugs. Mm-hmm. Most of them are really not needed. They're on 3, 4 blood pressure medicines. Nobody ever said to them, hey, do you snore? Do you snore? I mean, do you stop breathing when you're sleeping? And people say, well, what does that have to do with the blood pressure medicine I'm taking? Well, if you've got sleep apnea and you stop breathing and you disrupt the circadian rhythm, the sleep cycle, your blood pressure is going to be high in the morning. We know that. Studies, data, it's there. It's in the mainstream data. This is why sleep apnea is such a big deal today. I just read a study on my television show when I was doing one of the news reports about that. No, people say, well, nobody ever asked me that. Well, nobody ever asked you that because we don't have the time and doctors don't pay attention. That's the first thing I ask if I see somebody that's on more than 2 or 3 blood pressure medicines. Because if you have sleep apnea, you're going to be on 4 blood pressure medicines because your blood pressure is going to be sky high. So if I fix your sleep apnea, you're down to 1 drug. And I've done this with numerous people. So every one of those drugs, everybody comes in on a cholesterol drug. Everybody comes in on a blood pressure medicine. Everybody comes in on a stomach medicine, right? Everybody's got a terrible belly and digestion. Go eat your burritos and your tacos, but don't forget to take that drug before you go out.
Right.
This is what's wrong with us today, is the messaging is wrong. The message should be, don't be such a pig and eat that crap. Make better food choices, and you won't need that drug before you go out. Let's get you on a probiotic, and in anywhere from 1 to 3 months, you're off of that drug. Let's get you on some digestive enzymes, and you're off that drug. You need that diabetes medicine. I understand that. Let's get you on a probiotic. Let's get you on some cinnamon. Let's get you on some alpha-lipoic acid. Yes, I understand you're diabetic, fine. But let's make sure that those nutrients that are depleted are repleted or put back into your body. I understand that you have high blood pressure. No problem. But what about taking maybe a little bit of hawthorn, all right? Maybe some PQQ, and maybe some other new nutrients that we may have that may help lower that. Let's fix your sleep apnea, and instead of being on 4 drugs, maybe you'll be on 1. So that's what I do. I look at people, I spend the time, and I make sure that I don't look at you as a heart, a brain, a kidney, a liver, or a spleen. I look at you as a person. I want to make sure that your stress levels are taken care of. I'm going to suggest that you do a massage once a week. I'm going to tell you to get off of your butt and make the commitment to start exercising. I don't want any excuses. Don't whine to me. Whining doesn't work because you're wasting my time. Just do it. There's a company out there that says, just do it. Same slogan. Just do it and get on with it. So polypharmacy, when you really look at it, we can take people from 8 drugs, maybe 2. Not all the time,
sure,
but at least cut that down to minimize the side effects.